Hi, this is Leanna McDonald performing the physical exam. Cheryl, do you consent to this video?
Yes.
Okay, I'm going to wash my hands. And we're here for an annual physical. Do you have any problems or concerns you want to address?
No.
Okay, so we're going to start in a head to toe fashion. I'm going to omit the breast exam and the pelvic exam, but I will verbally describe the pelvic exam. So we're going to start with your head, face, and neck. Cheryl's face appears symmetrical. Her eyes and ears are well aligned. Her eyebrows and eyelashes are present. Her skin is warm, pink, and dry. Her hair is evenly distributed with fine texture. I'm going to palpate your scalp. Her scalp is round. I don't see any lesions. I don't feel any masses. Good. And the next thing I'm going to do is test a few of your cranial nerves in the face, starting with cranial nerve number 5, which is sensation. So you're going to feel a soft sensation. I want you to tell me yes when you feel it, okay?
Mm-hmm.
Close your eyes.
Yep. 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 Yep.
Good, so cranial nerve number 5 is intact. Next thing we're going to test is cranial nerve number 7, which is facial movements. So I'm going to have you raise your eyebrows up, squint your eyes shut, open them wide, puff out your cheeks, stick out your tongue. Good, so cranial nerve 7 is intact. We're going to test range of motion of your neck, so just move your head side to side, up and down. Good. She has active range of motion of her neck. I'm going to check her trachea and her thyroid. Her trachea appears midline. I'm going to have you swallow. Good. Her thyroid is not enlarged. And I'm going to take a listen to your carotid arteries for any bruise. I'm going to have you take a deep breath and hold it. Good. And again. Good. There's no bruise. I'm going to feel all of your lymph nodes, starting with your pre-auricular, post-auricular, superficial cervical, deep cervical, posterior cervical, submental, submandibular, occipital, supraclavicular, infraclavicular, and the tonsillar lymph node I'll check during the mouth exam. So she has no lymphadenopathy of her lymph nodes in her face and neck. I'm going to feel your temporal pulses. Good, her pulses are present. I'm going to feel your jaw this time, and I'm going to have you open and shut your jaw, okay, for your TMJ. So open and shut. And I don't feel any clicking. And then I'm going to have you move your jaw up and down and around. Good. And there's no clicking or TMJ present. Good. The next thing I'm going to do is test your eyes. So we'll move on to the eye exam. Just off of inspection, her eyes are symmetrical. Her lashes are present. Her eyelids are not drooping. I'm going to feel your lacrimal apparatus. Good, there's no swelling there. Her sclera are white, her irises are green, her conjunctiva are pink, and I don't see any drainage. I'm gonna just look down, good, nice and pink. The next thing I'm going to do is take a look inside your eyes. We're going to do cranial nerve number 2, so that would be your visual acuity as well as your confrontation to light. So I'm going to look in your eyes first, just look straight ahead. Good. Your pupils are equal and reactive to light and accommodation. And for visual acuity, we're going to use the Snellen chart. So Cheryl, looking straight ahead with both your eyes, I want you to read the lowest line that you can.
B, D, E, F.
Good. And then close your left eye, cover your left eye, and do the lowest line you can.
B, D, E, C, K.
Okay, and your right eye?
K, L, O, P, Q.
Good. So she has 20/20 vision in both, 20/30 vision in her left eye, and 20/40 vision in her right eye. She does wear corrective lenses, correct?
Yes.
Great. Now I'm going to take a look inside your eyes, okay, with the ophthalmoscope. And just look straight ahead. Good. I see the retinal vessels. She has a positive red reflex. There's no signs of hemorrhage. And I'm going to do the same over here. Good. I see the retinal vessels again with no signs of hemorrhage. And I do see a positive red reflex, which is good. I'm going to test your extraocular movements, okay, which is cranial nerves 3, 4, and 6. So I want you to follow my finger with your eyes, okay? Good. And then from your periphery, I want you to look straight ahead and tell me when you can see my hands, okay?
Can see them.
Okay, good. So cranial nerves 3, 4, and 6 are intact. So the eye exam is complete. We're going to move on to your nose, okay? From inspection, her nose appears midline. Her nares are equal. I don't see any drainage. Her skin around her nose is pink and dry. The next thing I'm going to do is test your patency of your nares. So I want you to block one nostril and take a deep breath in. Good. And do the opposite. Good. Her nares are patent. I'm going to take a look inside your nose and just switch over my light. Okay, now look up a little bit. So her septum is midline. I don't see any deviation. Her turbinates are moist, but pink, no inflammation. And I don't see any drainage in her nose. So that's good. I am going to test her cranial nerve number 1 at this time, which is her sense of smell. So I want you to close your eyes and tell me what scent you smell.
Cinnamon.
Good. So cranial nerve 1 is intact. We're going to move on to your mouth. Her lips are pink and dry. They're symmetrical. I want you to open up your mouth for me. Good. And take a look inside here. Stick out your tongue. Good. Her tongue protrudes midline. I don't see any lesions or masses on her tongue. Open up nice and wide. Her buccal mucosa are nice and pink and moist. She has good dentition. No mouth odor. Stick out your tongue. Say ah. Good. Her uvula rises midline. And then I'm going to take another look in the back. Good. I see her anterior and posterior pillars are nice and pink and moist with no exudate. One more time. Good. Her tonsils are 2+ bilaterally pink, moist, no exudate. I don't see any lymphadenopathy on her tonsils. And one more time. Posterior pharynx is pink and moist with no exudate. I'm going to take a look to lift your tongue up. And the floor of her mouth is nice and pink and moist and intact with no lesions or masses noted. Okay, great. So the next thing we're going to do is move to your upper extremities, okay? So I'm going to take a look at your shoulders, your elbows, your arms, and your hands. Looking at the skin, her skin is tan, dry, warm, no redness, no tenderness on the shoulders. Her muscle mass is symmetrical. And then moving down to the elbow, I'm going to test the same. The skin remains intact. Her muscle mass is equivalent on both sides. I don't feel any warmth or any tenderness. Moving down the arm to the wrist, her skin remains intact, warm and dry, no tenderness. Her muscles are symmetric, and down to the hands as well. Skin is warm, pink, and dry. There's no tenderness, equal muscle mass, and her nail beds are intact with no clubbing noted on any of the nails. So I'm also going to have you put your arm out to the side. I'm going to feel your epitrochlear nodes right here. Good, and there's no lymphadenopathy of your epitrochlear nodes. I'm going to test the reflexes in your arm before I test your range of motion. Okay, so I'm going to have you The first thing I'm going to have you do is put your arm out. I'm going to test your bicep reflex. I'm going to put my fingers on your antecubital. Good. And then your tricep. Good. Your brachial radial. Good. Good. So her reflexes are 1+. On the right, for this exam, purpose of this exam, the musculoskeletal, we'll just do the right side of her body. So I'm going to test the range of motion starting with your shoulder, okay? So I'm going to have you flex your arm up. Good.
This way?
Extend your arm. Good. Adduct, so away from your body. Move your arm away from your body. Adduct towards your body.
Sit down.
Nope, put your arm towards your body. Yep. Internal rotation. Put your arm up your back. Good. And external rotation. Put your arm to your side and move your arm outward. Good. So all of her range of motion is intact in the shoulder. I'm going to move to the elbow. So just flex and extend. Good. And we're going to do supination and pronation. So supination, I want you to put your palms up. Good. And pronation, palms down. Great. Moving down to the wrist. We're going to flex your wrist, extend your wrist, and ulnar and radial deviation, which you're going to move your wrist side to side. Great. And the fingers, I want you to flex your fingers, extend your fingers, abduct your fingers, so spread them apart, good. Adduct them, put them together. Great. And thumb opposition is last, so put your palm up, put your thumb to your pinky. Great. So Charlotte has active range of motion of the upper extremity. I'm going to look at your back now, listening to your lungs at this time as well, so if you don't mind turning to the side and see that sitting. Good. So her skin is intact on her back. I don't see any obvious lesions or masses. Nothing evident on the skin of her back. It's warm, pink, and dry. I'm going to take a listen to your lungs here, okay? So nice deep breaths. Good. 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 So her lungs are clear in all fields on her posterior lungs. I'm going to have you turn a little bit more towards the camera. Good. Yep. So I'm going to percuss her, all of her lung fields, okay? Good, and her lungs are resonant to percussion. I'm going to put my hands on your back, and I want you to say the phrase 99 each time you feel my hands, okay?
99, 99, 99, 99, 99, 99.
Good, so we're testing tactile ephemeris, which I do is intact, and I'm going to percuss your costovertebral angle. Tell me if you have any tenderness here.
Nope. Nope.
Good, so her no CBA tenderness is noted. I'm going to have you turn to the front again. We're going to test her anterior lungs and chest, which includes the lungs and the cardiac system. So I'm going to start by taking a feel. I don't see any pulsations or heaves on her anterior chest wall. I don't feel any crepitus or tenderness on the chest wall. Good. I'm going to take a listen. Some nice deep breaths. Good. And I'm going to listen to her heart sounds too, starting with the aortic. You can just breathe normally. Pulmonic. Erb's point. Tricuspid. And mitral. Good. And then with the bell on my stethoscope, the same. Aortic. Pulmonic. Erb's point. tricuspid, and mitral. Good. I don't hear any murmurs or extra heart sounds when doing so. I'm going to have you lay back because I do want to find the point of maximal impulse. So just lay back for a moment. Good. So it's at the 5th intercostal space, left midclavicular line. Very good. And I'm in a reclining position, recumbent position, so I'm just going to put a couple more pillows behind you so you're at a 45-degree angle. Okay, just lean back. Good, perfect. So in the recumbent position, I don't see any thrills or heaves or pulsations. And then I'm going to have you lay completely flat this time. Good. I don't see any heaves, thrills, pulsations. And have you look to the side a little bit? Yep. And I don't see any jugular vein distension in the other side. Yep, no jugular vein distension noted. While you're lying in this position, I am going to move to the abdomen, okay? So I'm going to do an inspection of the abdomen. I'm going to put a little drape here for you. Good. So starting with an inspection of the abdomen. Her skin is pink, it's intact, I don't see any bruising or lesions. I do see an old C-section scar.
Yes.
And the next thing I'm going to do is take a listen to her bowel sounds. Good. She has positive bowel sounds in all 4 quadrants. And then I'm going to take a listen to her aorta. Good. I don't hear any bruits. And then I'm just going to take a listen to your femoral and renal arteries, okay?
Mm-hmm.
Good. The next thing I'm going to do is percuss over your abdomen, okay? So I'm going to percuss I hear timpani of percussion over most of the abdomen, and then I'm going to listen over the spleen, which I hear some dullness, and the liver border, which is dull as well. And the liver is estimated to be about 7 centimeters in span. The last thing I'm going to do is palpate, starting with light palpation of the stomach. Any tenderness?
Nope.
And deep palpation of the stomach. Any tenderness there? I don't feel any masses upon palpation. And then I'm going to feel the liver's border, okay? Take a deep breath. Good. And the spleen. Deep breath. Good. So there's no hepatosplenomegaly noted there. I am going to check for inguinal hernias, okay? So I would just drape here, and I want you to cough. Good, and then cough. In a real exam, I would expose, but I'm not going to do that for the video. Okay, we're going to move down to the lower extremities. So while you're lying, I'm going to just take a look at your hips, your knees, your ankles, and your feet. Okay. Her hips, I don't see any redness or warmth, any tenderness.
Nope.
Her skin is warm pink and dry. She has symmetrical muscle mass and equal hair distribution. Moving down to the knee. The knee is also warm pink and dry. I don't feel any tenderness, symmetrical muscle mass, and equal hair distribution. And then moving down to the ankles and the feet. Her skin is warm pink and dry, symmetrical muscle mass, no tenderness, and equal hair distribution there as well. So I'm going to test the pulses of the lower extremities. So I would feel her femoral pulse again. Good. And then I'm going to feel your patellar pulse. You can just rest your Good. In the posterior tibial. Good. In the dorsal. Pedal pulse. Good. And her pulses are 2+ bilaterally. The next thing I'm going to do is test the range of motion of your lower extremities. Starting with the hip, I want you to bend your leg up towards you and flex your hip. Good. And extend your leg. Good. And then we're going to do abduction first. So I want you to bend your knee up and move your leg away from your body. Good. And adduction, move it towards your body. Good. And then internal rotation, keeping your knee the way it is. I want you to bring your heel away from your body. Yep. And external rotation, put your heel towards your body. Great. So you have active range of motion of the hip. For the knee, we're going to flex the knee as well, just like Gav, you have it, and extend. Good. So she has active range of motion of the knee. Moving down to the ankles and the feet, you can relax your foot down. We're going to do dorsiflexion, so flex your feet up towards you. Good. Plantar flexion, point your toes to the ground. Good. We're going to abduct your toes, so abduct your toes, spread them out. Good. And then inversion, I want you to point your feet towards you. Yep. In eversion, you can put your feet away from each other. Great. So she has active range of motion of your lower extremities. So I'm going to have you sit back up. Before we move on to the neurological exam, I just want to do a quick description of what I would do during the breast exam. I would do an inspection of the breast, looking for any discharge from the nipple, any dimpling, any obvious masses or nodules. And then I would have her do a couple of movements, starting with putting her arms up. Good. And then I'd have her put her arms down by her side, put her hands on her hips, and put her arms towards each other, and hopefully they would be symmetrical. And then I would do a complete palpation of the breast and the nipple, as well as the axillary nodes, and I would check for any nodules or masses and note them. So we are going to move on to the neurological exam. I'm going to test your fine motor skills in the upper extremities and the lower extremities, and we're going to do some other tests as well. So the first test I'm going to do is called your vibratory. I'm just going to move this a little bit away here and grab my tools here. So vibratory in both her wrists and her Achilles. So I'm going to strike the tuning fork and tell me if you can feel a vibrating sensation.
Yeah.
Okay, and I'm going to do the same thing on her Achilles.
Yep.
Good. I'm going to test sharp and dull sensation on different parts of her body. So I want you to close your eyes and tell me if this is sharp or dull, okay? Or soft or sharp.
Soft.
Yep.
Sharp.
Good.
Soft. Sharp. Sharp. Soft. Sharp. Soft. soft, sharp, soft, soft, sharp.
Good. So she has positive sensation on different parts of her body of sharp and dull objects. I'm going to do a test called 2-point discrimination. I'm going to have you close your eyes. I'm going to put 2 objects on your body, and I want you to tell me if there's 1 or 2 objects there and when you do notice them, okay? So is there
1, 1, 2,
Good.
1, 2,
Good. The other palm?
1, 2,
And the thighs?
1, 2,
The other thigh?
2.
Good. So she has 2-point discrimination at about 5 millimeters. The next test I'm going to do is called stereognosis. So I want you to put your palm out. I'm going to put an object in your palm and close your eyes and tell me what the object is, if you can.
Q-tip.
Correct. So her perception is intact. I'm going to test your fine motor skills here. So I'm going to have you touch your nose and then touch my finger like this. Okay? So touch your nose and then touch my finger. Do it again. As quick as you can. Good. Keep going. Good. And then I want you to opposite like this, as fast as you can. Good. And then I'm going to have you put your palms up and down on your lap as fast as you can. Good. So she has positive fine motor skills of her upper extremities and moving down to her lower extremities. Stand up. I'm going to have you slide your heel down your leg. Yep. And then the other heel. Good. And then I'm going to test her her position sense of her great toe. So just have a seat for a second and close your eyes and tell me if your big toe is up or down.
Up.
And this one?
Down.
Good. So she has positive position sense of her great toe. I'm going to test your gait. So I'm going to have you walk normally. Go ahead. Good. And then walk on your heels. Walk on your heels. Good. Walk on your toes. Good. And then walk heel, toe, heel, toe, heel, toe. Good. I'm going to do the Romberg test. So I want you to put your feet kind of in a line together. Put your arms by your side. Close your eyes. Arms by your side. Close your eyes. Good. And then pronate or drift. Put your arms up like you're holding a platter and close your eyes. Good. She has a negative pronator drift. I am going to have you test your bending too. I want you to do a nice deep squat for me. And up. Great. The last thing I'm going to do is take a look at your spine, okay? So I'm going to have you have a seat. Bend down towards your legs. Good. Inspection of the spine. The spine is midline. I don't see any obvious protrusions. So I'm going to have you flex your spine. So just wrap your arms around the bottoms of your legs, just like you were doing. Good. And round your back. Good. So she has good flexion of the spine. Extension. I want you to bring your neck all the way back. Reach your back. Good. Good extension of the spine as well. We're going to do some lateral bending. So stand up. Bend from left to right. Good. And twisting of the spine side to side. Great. The last thing I'm going to do nice and quick is your reflexes. Have a seat. I'm going to test your reflexes here.
It's on the ground.
Where is it?
On the ground. Underneath the table.
Oh, thank you.
Yeah.
Quick reflexes on the lower extremities. Your patellar. So just sit back. Your patellar.
Mm-hmm.
Good. Good. Your Achilles.
Yep.
Good. And your Babinski reflex. I'm going to bring this up. Good. And her toes curl in. Just And that's it for the physical exam. Thank you.